Welcome to Taking Your Medications, Session 2 of the learning series Living Well with COPD by RESPIPLUS. Living Well with COPD is a comprehensive self-management education program which successfully improves people's lives. In this presentation series, we will aim to help you learn more about how you can have an influence over your COPD. By taking the right actions every day, such as taking your medications as prescribed, you can improve your health and quality of life. I am Becky Zuko, and I have been accompanying you through this exciting series. As an exercise physiologist, I have had the opportunity to help many people with chronic disease improve their quality of life through exercise rehabilitation. The development of this learning course was made possible through a non-restricted educational grant from AstraZeneca Canada to RESPIPLUS, a non-profit organisation which directs the continuous development of the Living Well with COPD programme. Today, you will learn more about the importance of taking your medication properly, the medication families used in COPD, the types of inhalers used and how they work. Can you think of medications you are currently taking for your respiratory condition? Are you taking other type of medications? How do you remember to take your medications every day? It is very important to take your medications regularly and exactly as prescribed. Some people feel that having a set time to take their medications every day helps them create a good routine and avoid missing doses. Your health professional can suggest some strategies to help you take your medications on a regular basis. You should know the following about your medication: the name of each medication you are taking, what your medication dose is, the dose needed, when you should be taking your medication, how to take your medication properly, and the precautions and possible side effects. If you have any concerns about your medications or if side effects are present, ask the advice of your doctor and/or your pharmacist. Write your questions in advance and do not forget them. Remember, it is good habit to read the consumer information sheet that is included with your medications. Here are the types of medications that can be used in COPD. Bronchodilators are the most important medication in COPD therapy because they help open up the airways and reduce shortness of breath. Other types of medications may be required to help reduce respiratory symptoms. Anti-inflammatories reduce inflammation in your bronchi. They come in two forms, inhaled and oral. Finally, when you have an exacerbation, also known as symptoms worsening or flare-up, you will be prescribed additional medications for a short period, such as oral corticosteroids and antibiotics. Over the next slides, try to identify the medication families and devices that you are using. We will review each family of medication in detail. As mentioned, bronchodilators are the most important medication in COPD therapy. But did you know that there are various types of bronchodilators? Short-acting beta-2 agonists are used as a rescue medication, which means they are used when you need to alleviate your shortness of breath as they open up airways immediately. This is the type of medication that you would take if you suddenly have increased shortness of breath. For some people, they also can take them on a regular basis. It is recommended to take a short-acting bronchodilator before engaging in any activity that requires effort, for example, before exercising. Long-acting beta-2 agonists are indicated for maintenance treatment of COPD. They reduce breathlessness, disability, and exacerbation and improve quality of life. They open up airways for 12 to 24 hours. They should not be used as rescue medications. Short-acting anticholinergics make breathing easier by opening up your narrowed airways. They are usually taken regularly, multiple times a day, and for some COPD patients, they can be used as needed. Long-acting anticholinergics reduce disability and exacerbation and improve quality of life. They make breathing easier by opening your narrowed airways. They need to be taken on a regular basis. Bronchodilators are also offered in combination. For example, the combination of short-acting anticholinergics and short-acting beta-2 agonists work as rescue medication and open up airways immediately. For some people, it can also be taken regularly, 4 times a day, but with the advice of your medical doctor. The combination of long-acting anticholinergics and long-acting beta-2 agonists opens up airways for 24 hours and is indicated for the maintenance of treatment with COPD. The medication prevents shortness of breath and wheezing, reduces disability and exacerbation, and improves quality of life. Anti-inflammatories are another type of medication. As their name indicates, they reduce inflammation of your bronchi. Anti-inflammatories come in various forms. Inhaled anti-inflammatories. In COPD, inhaled corticosteroids can only be used in combination with bronchodilators, and hence they have a combined effect to reduce inflammation and swelling and open up airways. This combination makes exacerbations less frequent and can also be helpful for some patients to further relieve symptoms, but is not recommended as a rescue medication. Oral types of anti-inflammatories include the inhibitors of phosphodiesterases, PDE, such as roflumilast and theophylline. These medications result in less inflammation in the lungs and help to stop the narrowing of airways which occurs in COPD. They can only be used in addition to an inhaled bronchodilator medication. They must be taken orally on a regular basis and must not be used as a rescue medication. Finally, some medications are used to treat worsening symptoms, also known as exacerbations or flare-ups. Oral corticosteroids, such as prednisone, reduce inflammation in the lungs and are usually prescribed for short periods of between 5 and 14 days. Antibiotics are useful in treating respiratory infections such as sinusitis, infected bronchitis, and pneumonia. And the treatment has to be taken exactly as prescribed. Has your doctor prescribed an action plan so that you can recognise and act fast when you have worsening of your COPD symptoms? If so, do you have a prescription at the pharmacy? Who could help you quickly in case of an exacerbation? Investigate which resources are available to you, such as your contact person, a support nurse at the community clinic, or a COPD helpline. COPD medication must be able to reach your lungs in order to work. This is why the proper use of your inhaler devices is essential to prevent and manage your symptoms. Most patients have difficulties with using certain inhalation devices and keeping a good inhalation technique. If you use your inhalers incorrectly, the medicine may not get into your airways as it is supposed to, and the therapy could be less effective. Handling these devices should become second nature to you, like a reflex. Let us now see the different types of inhalation devices in COPD. The devices that deliver your inhaled medications are classified in 3 categories. 1. The metered dose inhaler and the spacing device. 2. Dry powder inhalers. And 3. Soft mist inhalers. With a metered dose inhaler, also called inhaler or puffer, the medication is dispensed by pressing down on the canister which releases a spray of medication at a set dose. When using a metered dose inhaler, you need to coordinate your inhalation with the activation of the inhaler. Some metered dose inhalers include a dose counter. Do you normally use a spacer for your metered dose device? The use of a spacing device is highly recommended since it increases the amount of medication reaching your lungs and diminishes the amount of medication remaining in your mouth and throat, which may reduce some of the drug side effects, such as a bitter taste, hoarseness, and thrush. The dry powder inhalers deliver medication as a powder to your lungs when you inhale. The coordination of your inhalation and the medication released is greatly simplified. Some of these devices are unidose. You only need to put a new capsule inside the device to get each dose, while other devices are multi-dose. The device is preloaded with multiple doses. The soft mist inhaler is a new type of inhaler which is propellant-free. It releases medication slowly and gently, making it easy to inhale into your lungs. The medication is delivered as a soft mist, which is suspended in a cloud longer, simplifying the coordination of inhaler activation with inspiration. Were you able to identify your medication and inhalers in the previous slides? For specific information on how to use your devices and how to use your device, please look at the learning activities in livingwellwithcopd.com, where you can find videos explaining in detail the inhalation techniques for each of your devices, explanatory sheets listing the techniques step by step, and additional information such as how to clean and maintain your inhalers. Remember that having the proper inhalation technique is very important. Get your technique checked by your healthcare provider or your physician from time to time. Can you think about the most important elements learnt today that you can integrate into your daily life? You now have a better understanding of the importance of taking your medication as per your prescription and with the proper technique. Remember that taking your medications properly can help you manage better your symptoms and live a fuller and more active life. To learn more about today's topics, consult the learning module Prevent Your Symptoms and Taking Your Medications, available for free at www.livingwellwithcopd.com. We would like to acknowledge all the professionals and patients who have contributed their time and thought in order to enrich the Living Well with COPD programme, and especially Mrs. Pauline Anderson. Their dedication and help has allowed us to continue enhancing the lives of people living with this disease and their loved ones. Thank you.